Well, Toronto Public Health is sending more than 18,000 letters home to the families of teenagers in grade 11 saying that their vaccinations are incomplete. The goal is to get students caught up and boost community protection from vaccine-preventable diseases. So joining us live now to discuss the effort to get students caught up with their vaccinations is pediatrician and founder of Kid Crew, Dr. Dina Kulik. Dr. Kulik, Happy New Year. Thanks for joining us to talk about this very important issue. We know that the pandemic really wreaked havoc on vaccination schedules, and a lot of grade 11 students are incomplete in terms of their vaccinations. Which vaccinations are we talking about here?
It could be any of the vaccines, really. So we do vaccines as newborns, as in little babies, until about 18 months. And then we repeat some vaccines at age 4 to 6. And then there are some very important vaccines that we do in grade 7 and again in grade 8. And I think a lot of these high schoolers are missing those ones because they were in grade 7 and 8 at the height of the pandemic.
Yeah, they were supposed to be getting these vaccinations in grade 7, and of course they missed it. Also, students in grade 12, they're also incomplete as well.
Yeah, because these kids were in grade 7 and 8 in 2020, 2021, when for some time, about 1 or 2 years, depending on the area, we weren't giving these vaccines at school, and people weren't historically getting them in the doctor's office. So they could have been missed. Many of these kids haven't followed up with their primary care provider in a few years either. So we may not know that they haven't received these vaccines.
And just to give you an idea, for the 2023-24 school year, for kids in the coverage for the DP-TAP vaccine was 46.5% compared to 81% in the 2017-2018 year. So, Dr. Kulik, we know that there's a challenge right now for some families and even kids trying to find family doctors. What's your advice to them in terms of how they can get caught up with getting their vaccinations?
Yeah, so I definitely recommend that people follow up with their primary care provider if that person is available to you, whether it's a nurse practitioner or a family doctor or pediatrician. If individuals don't have one of these primary care providers, you can certainly follow up with your public health group, so Toronto Public Health where we are, or others where other people live, and they can double check what vaccines that child has had, make sure they did get those important childhood vaccines, the 14-year DPTP, as you mentioned, the tetanus booster that also covers for whooping cough or pertussis, which is on the rise, as well as those important grade 7 and 8 vaccines, Toronto Public Health or other public health units where people live.
Okay, so if a person doesn't have a primary health care provider or family doctor, they can go to a walk-in clinic or even try to book it through the Toronto Public Health website?
Correct.
Okay. And Dr. Kulik, what are you seeing at your own clinic in terms of, children and vaccinations? Are you seeing less people come in? Have you noticed any trends or differences yourself?
So at Kid Crew, where I work, we've been pretty obsessed throughout the pandemic and since making sure kids are having the routine wellness checks and baby checks. And so I think as a whole, we've done quite well in keeping kids up to date. But certainly there are a lot of families that were fearful during the pandemic of coming in, and maybe we've kind of fallen off the radar for the follow-ups. A lot of families that moved or lived temporarily elsewhere during the height of the pandemic. So we definitely encourage all of our families to come in if you haven't come in recently, even if they think the vaccines are up to date, because seeing in person is important. We do measurements, we do blood pressure checks, we make sure the child is doing well. So vaccines are important, but the wellness checks are also important for many other reasons.
Yeah, absolutely. And Dr. Kulik, it's up to the family or the parents really to update that vaccination record, right? The primary care provider, the city, Ontario, they're not going to do it for you. So it really is on the families, correct?
Yes. At the moment, there isn't any kind of centralized electronic system that us as primary care providers can update. It is up to the family at the moment to keep public health updated with vaccines they received, whether it's public health or pharmacies or with the primary care provider.
And Dr. Kulik, lastly, the province saw 64 cases of measles last year. In terms of getting vaccinated for measles, how important is this for that younger population?
Very important. Measles is definitely on the rise, as is other vaccine-preventable illnesses like pertussis, whooping cough that I mentioned earlier. A lot of families don't really worry about certain vaccine-preventable illnesses because historically we haven't really seen them much. But as vaccine rates go down and as there's more resistance or hesitance around vaccines, we will absolutely see a rise in some of these illnesses, which can be quite devastating, can cause significant illness, can cause death in children.
Okay, so once again, Toronto Public Health sending home those letters. If you've got a kid in grade 11, even grade 12, check your vaccine and make sure it's updated. Dr. Dina Kulik, thanks so much for your time. Appreciate it, and Happy New Year.
You too. Thank you.